COVID-19 hospitalizations are surging across the nation, including here in western Wisconsin. Alyssa Lyons spoke with area hospitals about current capacities and compares the change in COVID-19 hospitalizations from now to this time a year ago.
Keith, according to the Department of Health Services data, in the second week of August in 2020, COVID-19 hospitalizations were beginning to decline. Now, a year later, that average has doubled in comparison. In July, the Eau Claire City County Health Department reported an average of one positive COVID-19 case a day, compared to now in mid-August, where the average has spiked to 28 positive cases a day. With the increase in cases, so has the number of COVID-19 hospitalizations. According to the state DHS, during this week last year, hospitals saw a weekly average of 15 COVID-19 patients, with 4 requiring the ICU and 14% placed on ventilators. Compare that to now. The weekly average COVID-19 hospitalization rate has doubled, with 3 COVID-19 patients in the ICU and 2% placed on ventilators.
Our numbers are climbing daily, and it's a direct result of the unvaccinated getting the Delta variant of COVID-19. Last year, everyone was masked up pretty much because we were aware that COVID was coming and we were prepping for it.
Health officials say the average time a COVID patient stays at the hospital varies, though they report some patients have stayed for more than 3 weeks at a time. Just last week, new COVID-19 hospitalizations in Eau Claire County increased by 7, putting the overall total of hospitalizations from the start of the pandemic to now at 441. With the Delta variant surge, health officials worry that number is bound to continue climbing.
When we have more cases, we see more hospitalizations. It's a lagging indicator. It doesn't happen as early, but certainly after cases start to increase, hospitalizations start to increase. And unfortunately, after hospitalizations increase, we expect increased deaths as well.
According to officials with Sacred Heart and St. Joseph hospitals, patient capacity hasn't changed.
We've been at capacity since the last wave of COVID. We've had very few days when we weren't discharging and readmitting to the same number of beds. And the whole city's been that way. We've been very, very busy. People delayed care through the first COVID surges, and we've been seeing that ever since.
Even though the hospitals are at capacity, officials say the locations are not at the point of diverting, but have a plan in place if patient capacity continues to increase.
If we're all at capacity and on divert, we take turns taking the next ambulance so that no one hospital gets completely overwhelmed.
When I spoke with the Eau Claire City County Health Department today, officials say they were notified that 50% of hospitals in the Northwest region are reporting peak capacity in their ICUs. In a release from the Mayo Clinic Health Systems, 90% of COVID-19 patients admitted to the hospital are unvaccinated.
Okay, thanks, Alyssa. You can find data from today's story at WQOW.com.